Monkeypox cases are on the rise in the valley and across the nation, and the Biden administration recently declared the outbreak a national emergency.
More than 100 cases of monkeypox have been reported here in Arizona and more than 6,000 cases nationwide. Plus, getting the vaccine has been difficult. Fox 10's Marissa Sarback spoke to a valley man who's battling monkeypox. She talks about all the issues that come with it. Marissa.
Linda, quite a few issues come along with it. And right now, that man is in isolation in his house. He actually did an interview with us via Zoom just so he could explain what he's feeling. He said fever, chills all accompany that rash that he was expecting to see. But at first, he wasn't sure what he was noticing. And he said, pay attention to those symptoms because they can be different for everybody.
I woke up Sunday morning and my lip was just completely swollen. And on the top of it was a little white spot, and it was oozing stuff.
Later that day, he went to the hospital, not sure what was wrong. After CT scans and other tests, they finally decided to test him for monkeypox.
They asked me if I was a homosexual and if I had been out of the country recently, which I am a homosexual, but I haven't been out of the country.
By Monday, he got the results, positive for a disease now labeled a public health emergency by the Biden administration.
Having doctors tell you that they don't know about this is scary because what am I supposed to do? And I didn't even get any pain medications for this until Friday.
He's been in self-induced isolation, waiting to get the antiviral medication that he likely won't see until Monday, marking exactly 1 week since his diagnosis. He's called the Maricopa County Department of Health, his primary care physician, and the CDC, trying to move this forward, feeling like he's had to fight the medical community the entire way.
It's not like they see monkeypox or have seen it earlier in their career. So there's a learning curve for clinicians to start being able to effectively recognize what the rash looks like.
Will Humble with the Arizona Public Health Association says there are only 3 labs that can even test for monkeypox in the state of Arizona. And the Arizona Department of Health Services doesn't require cases to be reported, meaning we don't actually have an accurate reading.
It puts Arizona at a disadvantage when it comes to competing with other states for the limited supply of vaccine that's out there.
And while most infected are recovering, there are situations where that's not the case, making access to the vaccine or the antiviral medication crucial to stopping the spread.
It's not technically a sexually transmitted infection the way, say, chlamydia or syphilis or something like that is, but the direct, intimate skin-to-skin contact that happens during sex spreads this virus.
While many of the cases we're seeing are spread through sexual contact, health professionals say you can actually get it through prolonged skin-to-skin contact with anyone who is currently infected. Reporting live in Phoenix, Marissa Sarback for Fox 10 News.